Speaking of sensitive, Mississippi Healthcare Alliance, a nonprofit medical association dedicated to improving the health status of Mississippians, recently made available targeted temperature management machines for qualifying hospitals across the state. I thought that was pretty neat. Dr. Harper Stone joins us, the MHCA board president. Good morning, sir. How are you?
Good morning, Paul. How are you doing today?
I'm doing fine. What the heck is the targeted temperature management machines?
Well, let me tell you about it. Okay, what we've done is people. There's about 350,000 people a year in the United States that die outside the hospital. And what happens is they will get CPR and then they will get a pulse back and a blood pressure. They bring them in to a hospital that may be capable of putting a stent in, and they do that. But what happens is they have permanent brain damage from the lack of oxygen for the period of time while they had no pulse or blood pressure. So what these people usually die from is not from their heart, but usually from brain damage from lack of oxygen. There's a new technology called targeted temperature management, and we have machines that we actually cool people's bodies down to around 89.6 degrees Fahrenheit to around 93.2 degrees Fahrenheit for a period of 24 hours, and this gives the brain protection over that period of time so that you try to limit the amount of brain damage that happens due to lack of oxygen. And by doing this, we've seen a significant increase in survival on these people that actually walk out of a hospital neurologically intact, where they can go back and possibly go back to their jobs and function, whereas if you don't do, there's a good possibility they won't leave the hospital, they'll die, and they may end up surviving but ending up in a nursing home where they never wake up. So this is really, really this is our next step in what we're doing in Mississippi. You know, we're the first state to have a system of care for heart attack, stroke, and trauma in the whole country. And so we've got these things up and going. And so this is our next endeavor, because we know that if we can improve and save lives by doing this, we're going to get people back to work. We're going to save hospital costs, healthcare costs by doing this.
What do they look like? What do these machines look like?
Well, these machines are machines that, well, basically what it is, if you lay somebody on top, you wrap people in these devices, and they're wrapped and they're cooled and they're monitored for that temperature, and they slowly drop that temperature, and we keep them cool at that level for about 24 hours. But it's kind of a wrapping device.
Kind of like
almost not like a catheter or anything. It's non-invasive, where it just wraps outside the body.
Kind of like a Yeti cooler wrap or something like that. You're just gonna...
That's right. but this is going to make an impact. There's about 20 centers in our state that actually takes care of heart attacks with stents, and so these are going to be the centers that we focused on. A lot of centers already have them. Some centers don't, or some have older units that are not as good. We're trying to make sure every center in our state has.
What's the cost of these things?
They're about $30,000
each.
And but I can tell you, you save somebody's life and you get them home to their family, you get them back to their jobs. You not only save their family's cost, but you're also the impact on the cost of putting them in a nursing home for 15 years is huge. I mean, this really is going to make a huge impact.
We talk about that, and you said it earlier. We have, from the paramedics and the EMTs all the way into the hospital, we've done such an incredible job of networking and communications over the years, and thanks to your group, there are people now celebrating anniversary after anniversary because of that.
Yeah, and I want to mention one other thing that we think is a huge impact on out-of-hospital cardiac arrest. That's what it's called. In addition to cooling, we're the first state to actually have every student in the state to be trained in CPR before they graduate. We furnished every school, public and private, with CPR kits, and we train 60,000 students a year on CPR. 70% of people who die outside the hospital are at home. So this is 70% of these people are family members at home that die, and if those students know CPR, they can save their lives. So we're excited about that, and then once they get to the hospital, they get cooled with these devices. We hope this is going to make an impact on saving lives in our state.
It is exciting. You said about 20 facilities across the state?
There's 20 facilities across our state that can take care of heart attacks by putting stents in.
Mm-hmm.
We have about 100 hospitals in the state, but a lot of these hospitals can't do heart caths and put stents in. There's about 20 facilities that can, but they're spread out across the state so that no matter where you live in the state, we want to give you the state-of-the-art treatment for people who die outside the hospital. So this is going to be everywhere in our state. We're going to make sure everybody's up to snuff, standardized care for this, and we think this is going to make a huge impact on saving lives.
We didn't plan it that way, but Timothy Moore, the president and CEO of Mississippi Hospital Association, was on before you. But when you look at that networking across the state and all of a sudden you see something like a Clarksdale hospital possibly shutting down, that's a little scary when you're talking about networking. That's one of the pieces of the jigsaw puzzle that's going to be a big black space there, and that's a little bit scary.
It is a little bit scary. You're exactly right. I would like to say, though, in Mississippi, we have been very fortunate with our hospitals coming together, our EMS providers, and our physicians working together and putting any competition between them aside to really put Mississippi ahead of, profits and all that. So we're very fortunate to have such a great group of hospitals, doctors, and EMS providers working together. And it's really been outstanding the way things have worked. But you're right, we're going to have gaps. We're going to have to come up with plans on where they're going to go and how we're going to get them transferred to the appropriate facilities. We do have standardized protocols for transfer. So wherever they go, those hospitals will know if they're having a heart attack where they need to send them. There won't be any question. They will know where to go.
I'm not sure what the follow-up was on. We were talking with, in a Morgan White remote that we did several weeks ago, we were talking about with the Insurance Commissioner Mike Cheney about the FAA reauthorization that dealt with helicopter care as well as apparently transfer cost. And the costs were just outrageous in some places. But have you guys been brought into that conversation?
We have not been brought into that right now, but fortunately, the way that our hospitals, our 20 hospitals in our state are set up, if you take that hospital and draw all the hospitals that are smaller hospitals, you draw a circle around it, there's a hospital that takes care of heart attacks within a 60-mile radius of any of those hospitals. So really, as far as flying, there could be less flying there because it's a closer hospital. Mm-hmm. The only area where that's a problem is like Winona in the middle of the state where they're outside that 60-mile radius.
Quickly, if you want more information on this, is there a website to go to?
MississippiHealthCareAlliance.com, yeah.
Do that, Mississippi Healthcare Alliance. Always a pleasure. Love to see you in the studio. It's always good to have a doctor here in case, I get roll over or something, but you can't do that on the phone.
Well, let's hope not. But we thank you for allowing us to talk about this. We're excited about it, and again, thank you.
Keep up the good work, sir. Appreciate it very much. Dr. Harper Stone, Board President, Mississippi Healthcare Alliance. Mississippi Health.